So we're going to talk about toddlers, a funny age. The age group for toddlers is 12 months to 36 months, although the closer they get to 3, the more they act like preschoolers. So we're going to start with Erickson. And Erickson says the stage for this age group is autonomy versus shame and doubt. So the child wants to be independent. And if they're not successful at being independent, they will actually have kind of poor self image of themselves. So it's important as an adult, we encourage independence in this age group. Yes, you could put your shirt on by yourself. We don't want to say, no, give me that shirt, you cannot do it. Because unfortunately, the shame and doubt causes the child to continue to have doubt whether they can do things, and it will follow them throughout their entire life. So they want independence. They want to practice new physical things and gain some experience walking up and down stairs, running, using a spoon. Those are all important to this age group. Yes, they are very negative. It usually improves closer to 30 months, which is 2.5. But until then, they're negative because that's how they seek out their independence, is to say, no, I want to do this. No, give me. I want to do it my way. And that's pretty normal. We want to be positive so that we don't encourage being negative. But we certainly need to understand, especially when we take care of 2-year-olds in the hospital. No, me do it. Okay, you do it. You don't want to say, yeah, you're going to spill it all over. No, this is your medicine. You want to find a way for them to do it. They're very ritualistic. They want things the same way at the same time every day. And this is important for us to understand that for toddlers, so that if the parent cannot stay with the child, we get their routine that's at home, and as much as we possibly can, we'll follow some of the routines at home. For instance, if the child's being potty trained, we will try to help potty train them while they're in the hospital. It's generally hospitalization causes a regression and it may not work, but we want to continue what's normal for them. If they always go to sleep with a teddy bear, when it's bedtime, we want to give them a teddy bear. So they like the same pages in a book read over and over and over. They like to eat the same foods, macaroni and cheese, 3 meals a day, every day of the week. They need routines, and that's how they thrive. They understand at this point that the good things they do will be rewarded and the bad things will be punished. No. Punishment, it's taken away from them. They get a sharp knife, it's taken away from them. But they do something good. And even in the hospital, it's important for you to catch them doing good things. And, that's great, good job. And then if you see them doing something naughty and no one else does, it's important to say, no, we don't do that here. Sit here and time out. They realize, because of the autonomy, that they're separate from their parents and they can start taking steps away. As an infant, they don't realize that. That's why they don't have independence. They think they need a parent or a caretaker to be with them and do everything with them. Now they realize that they're not part of that body and they are separate and they can be a little bit independent. So let's talk about Piaget, our cognitive theorist. The sensory motor stage, which is our infant, begins to transition, usually around age 2, to the pre-operational stage. The pre-operational stage is very interesting. It's where the child is slowly beginning to understand logic, but they don't. They actually don't until they're about 7 years old. So the preoperational stage, um, lasts till they're 7. During that time, other things the child does help seal in where they understand logic. So, for instance, object permanence becomes developed. The child has to learn that when the parents leave, they're going to come back. Now, in the hospital, a parent walks away to go home and leaves the 2-year-old alone in the hospital. The child's going to cry and carry on because in their mind, that parent's gone forever. So, what we can have the parent do is bring something that they can leave with the child that's theirs and theirs personally. So, a t-shirt, a scarf, a pair of gloves, a picture, something that the child says, oh, my parents are going to come back. It puts it in their mind. My parents are going to come back. They wouldn't leave this here. They start to remember things. Remember the last time you stuck your finger in the socket? I had to put you in timeout. They remember that. So this is how they're learning. This is how they're learning logic. I'm going to be good because I don't want to go in timeout. Remember the last time I gave you medicine and you took it so nicely? I gave you a sticker. It made me happy. They're going to remember that and want to do it again. Domestic mimicry develops. This is a term you really, really have to remember. Toddlers and domestic mimicry go hand in hand. There's a few terms here that you really, really have to know. You're going to hear it again and again, and you're going to be asked about it again and again. It's really important that they learn to understand how the world works. And the way they do that is by role playing. So they really enjoy playing the roles of adults in their lives. So that's what domestic mimicry is. Even though these children will play by themselves, they'll play that they're the mommy or the daddy or the nurse or the doctor or the teacher. It's an important step that children do. They will mimic previously seen activities. So, and they'll mimic it the way they see it. So they're watching TV and there's a guy on a horse and they want that. So what do? They want to ride a horse. So they do what's known as symbolic play. They get a broom and they ride it like a horse. Symbolic play. They'll find something that in their own mind it could be symbolic for another, image or another thing. They're very egocentric. They can't see things from another person's point of view. They don't care about another person's point of view. It's all about me, and I'm the only one that's important. And it's important that we understand that. And they can't even fathom trying to look at someone else's point of view. So their growth slows down a lot. So we're going to see that their weight is not growing very fast, and a lot of parents are very concerned about that, but remember, it's normal. So about 30 months old, their child will weigh about 4 times their birth weight. Remember, 12 months, they weigh 3 times as much. Well, 30 months, which is 2.5 years old, they should be 4 times as much. Their height is slow but sure on a steady climb. So now we only measure them usually once a year, and they should grow about 3 inches a year or 7.5 centimeters. So until the child is 2 or a little bit older, depending on the child, we always measure the child's length lying down because they have a little bit of lordosis. So when they stand up, a child under 2, usually you'll see a little pot belly going on there. It's because their back sways a little bit and pushes that belly out a little bit. So that also makes them a little shorter or look shorter if you go to measure them standing up. Around 2, their stance is usually pretty straight. The spine is usually pretty straight. So the lordosis is disappearing, which actually makes them look a little bit skinnier, which concerns a lot of moms a lot. And it's okay now to measure them standing up and get a nice accurate height for them. Let's go to their head and chest, around 2-ish, sometime between 1 and 2. Some kids are earlier, some are later. Nothing's a definite. Not all kids read the textbooks. Their head circumference and the circumference of their chest should be equal. Not that we measure their chest too much anymore as newborns. In the olden days, that was a cool thing to do. And then we watch it till all of a sudden one day it's equal. But just in general, it should be. Their anterior fontanelle usually closes somewhere between 12 and 18 months. And I'm going to tell you the latter is the most common. It closes up. You won't feel that little soft spot any longer, their anterior fontanelle. And so after 2 years old, there's no need to measure their head. Their head really is pretty much as big as it's going to get. And then myelination is usually completed once again at the end of the second year of life. So remember, the first year ends at 12 months. Then from 1 to 2 is our second year. So it's after they're 2 years old, it's usually completed. The myelin sheath, I don't know if you can go back in your mind, and I think you may have learned this in anatomy and physiology. The myelin sheath is this milky white, slippery, sticky. Slippery and sticky, I guess, are different, but if you ever touched it, it would feel kind of sticky to you, but it's slippery on the spinal cord. It coats the brain and goes right down the spinal cord. And it is where electrical impulses are conducted. So, and it starts in the brain and it works its way down. So the child matures motorly from the head down. So the first thing they can do, remember, is pick up their head. The second thing would be like they can pick up their chest and maybe raise their arms. So we can see it happen if we just watch their gross motor skills. We can see it happening. The myelin sheath has to be almost complete before a child can walk. It's very, very important that it's completed. So when people are pushing their 14 or 15-month-old children to walk, well, their myelin sheath isn't at that point yet for them to walk, so it's okay. Now, if a child's not walking by 18 months old, they're delayed, and we need to have them see a neurologist to find out what's going on with myelination with them. So the myelination should be completed by the end of the second year of life. And we don't know exactly when. Some kids are sooner than others. A lot of babies walk at 1 year old or a little bit earlier, so it's almost complete at that point. It has to be almost complete to walk. So it goes hand in hand. And the motor control, needs those electrical impulses. So the myelin sheath has to be complete for things to function, for fine motors to start, and so forth. And then their vitals begin to slow down a little bit. And what's important here is, here's some numbers for you. But what I want you to do is kind of recognize where a toddler is. Will I ever say, well, what is their heart rate? No, but you might get a question like, a toddler's heart rate is 62. What do? Do you chart it? Do you call somebody? Do you assume something's wrong? Do you check their medications? What would you do? What would be the critical thing to do at that point? It's only 62. Could you have them sit up in case maybe you're missing a beat? There's a murmur there. Could they be having some cardiac problems? So I want you to critically think, but you need to know the kind of the normal. So 70 is probably the lowest a toddler should be. And I'll be honest with you, a toddler is usually closer to 90, 80 to 90, most toddlers. Again, with the respirations, if they start having wheezing and, RSV and asthma and all that kind of stuff, a normal respiration is 20 to 25. So, okay, the kid's 40. That's almost double what a normal respiration is. So something's going on with this kid. So that's what these numbers are. You're not going to be asked to give exact numbers. But if you can recognize what's normal, then you'll be able to recognize what's abnormal. So nutrition with the toddlers is the funniest thing. First of all, we talked about the myelin sheath. The myelin sheath itself is, I think they say 80% lipids and 20% protein or something very, very close to that. So it's fat. So we don't naturally have a lot of fat in our body when we're born. And so between 1 and 2, when a child is starting to move around a lot, they're burning calories, burning fat. So what are we going to do? We're going to take them from formula to whole milk. Whole milk is the fattiest milk there is. And from 1 to 2 years old, we're going to do that so that, I always say to the parents, so your child becomes very smart, because they really don't understand the whole myelin sheath stuff. So we want to put fat in their body. We don't want to restrict fat from 1 to 2. After 2 we do, but not from 1 to 2. And so we want them in milk, our whole milk. We want it in a cup. We want them to have somewhere between 24 to 28 ounces, and that's it. We don't want them to live on milk and nothing else, because like I said, there's only 20% protein in it. So it's not everything a child needs. Okay. They love finger foods. And we want to start using utensils, but in the beginning, they'll do finger foods. And at the end of their toddler age group, they'll start using their utensils. The amount that they should eat is about 1/4 of what an adult, 1/4 to 1/3 of what an adult will eat. Sometimes parents put these huge portions and make the kids sit there till they eat it all. That's not a good idea, is it? Or they'll give them snacks, like a whole bag of chips. Well, obesity is a problem with our youth, and it carries on to adults, and it's a really tough thing. If you start as a little kid being chubby, as an adult, it's really, really a hard life for you. So remember, between 1 and 2 should be 1/4. And then as they go between 2 and 3, they're going to be a little hungrier. They can have 1/3 of an adult portion. So they should begin to use cups, at 1. They should not be using a bottle. That bottle has to go away, or we're going to ruin their teeth. So they should use a cup and use utensils no later than 2 years old. So, 1 year old likes finger foods, but they usually can use a spoon a little bit. It's hard for them to get the spoon level to put in their mouth. They usually want to turn their wrist a little bit, with the spoon, and it falls off, but they should start practicing. They definitely should be feeding themselves. One thing about toddlers is we feed them when they're little. Food is exciting to them. Somewhere between 6 months and a year, taste buds begin to develop. And so some kids maybe don't like things that they used to like or they used to eat and like other things. They become very picky eaters. The other reason they're picky is they're very active, and they don't grow very fast now, so their appetite has decreased. And it's very difficult when you went from this baby who would sit there and eat a lot of food, and now this little toddler takes a couple bites and they're done. But it's normal. They're not growing fast, and that's what you'll tell the parents. They're not growing as fast. In fact, they're growing about a quarter as fast as they did in the past. So they're not as hungry. They even go through eating jags where they'll eat well one day and not the next day, or well one meal and not another meal. This is called physiologic anorexia. So you want to remember domestic mimicry. You want to remember physiologic anorexia for the toddler. It's quite normal. So they may go a day or so not eating well, but they'll make up for it on the following day. Be careful if the child is drinking too much, they won't eat. That's why it's so important to get rid of the bottle at 1 year old and have the child on a cup. Because that bottle, they'll just suck down 8 to 12 ounces in a couple minutes. And it's so much easier than to sit and eat and chew and swallow. We don't want them not to eat foods. Juice is kind of dangerous to little kids for many reasons. Juices is sugary, so it's ideal if people will water them down and just actually give them a tiny bit of juice, just the flavor. It's also very fattening because it is sugar. So this is a generous amount of juice for a child. They can have 4 to 6 ounces of juice a day if the parents are so inclined. So sometimes those little tiny juice boxes, one of those a day, isn't a bad thing. Remember though, juice can cause dental caries, can cause cavities for little babies. So we really want parents, if they give them juice, to give them a sip of water afterwards or brush their teeth, and it's just not always convenient to do that. So a special treat would be water, would be better than juice. And then we have to worry about choking foods. At the end of this PowerPoint, I do have some choking foods. Remember, food needs to be cut up very, very small. We used to say the rule of thumb, and that means that the child's thumbnail is about the size that the food should be cut up, very small, and not things that could choke a child, and we'll get into those in a little while. So sleep, a normal sleep for a child is 11 to 12 hours, and that includes their nap. In the first year of life, most babies take 2 naps a day. 1 year old, they usually somewhere between 1 and 15 to 18 months go down to 1 nap. And then after, 2, they usually are not too excited to nap any longer. We need to make sure they get their 11 to 12 hours in a night then. Usually during the toddler age group, and it's more the twos are a little more difficult. They don't want to go to bed. They're either too excited about life, or they may have been developing some fears and they're starting to dream and they'll have fears and they don't want to be alone. Remember, they realize they're separate from the parent's body, and when they go into a room by themselves, they really at that time feel that they need their parents. One of the important things to do when child is a baby is to lie them down awake alone so they learn to go to sleep on their own. If that hasn't been done, this is the time that it's payback time, because the child just refuses to go to bed. The child needs a bedtime routine. We get our bath, we have a little bedtime snack maybe, brush our teeth, read our story, and we go to bed. And it has to be a routine. Remember, they love routines. It has to be a routine, and parents just have to stick with it. Now, in the hospital, if we know the child's routine, it's helpful if we try to follow it if the parents aren't going to be there and we're going to be in charge of this child as much as possible. Of course, we have to give in a little bit because this is a new environment for a child. As far as their teeth goes, they're usually by 2 they have all their teeth, and the caregiver, the parent, whoever takes care of this kid, needs to be the one that flosses and brushes their teeth. The child certainly can have a toothbrush and try it on their own, but children do not do a good job, and this is an important thing to keep those teeth clean and free from bacteria. When children get those little black teeth, they call them dental caries. The layman's term for it is bottle mouth cavities, and that's because what usually causes cavities in a little child like this is a child that goes to bed with a bottle of milk or juice, and the sugar sits on on those teeth all night long. So if the child does get a bedtime snack, and especially if they get milk or fruit or juice at night, they really need to brush their teeth. And then after that point, before they go to bed, water should be the only thing they drink. And usually somewhere between 2 and 3 years old, they should see the dentist. The skills for them, we have to mark them down different ages, because if you could just picture these different age groups, which I know is really hard if you haven't been around a lot of kids, you can see, how each age group does it. Unfortunately, this is just something you kind of have to memorize. Use your Denver development form, and that will also help you. But around 15 months, they usually can put one block on top of another. By 18 months, which is 1.5, they usually can put 3 or 4 blocks, a little bit fine motory. They can use a spoon, usually by that age group, 1.5, without rotation. And that's what I was trying to tell you. Sometimes they tip it and the food falls off. Well, about 1.5, they should be able to do it nicely. And then when they look at a book, they usually will turn several pages at a time, and you can get by with doing that sometimes when you're reading them stories at 1.5. 2-year-olds can make their towers taller, and they can sit and actually look at a book and turn each page. And then 2.5 is pretty mature. They can usually draw a circle, and they usually have great hand-finger coordination. So for gross motor skills, I was thinking that they can do a puzzle too, a big puzzle at 2.5. For gross motor skills, kids start to walk anytime around 12 months, sometimes before, all the way up to 18 months. The average child can walk at 15 months, and they also can creep upstairs. Creeping upstairs, that's almost like crawling and walking halfway, holding on to the side. And we're talking up, not down. 18 months, when they run, they're clumsy, but they start to run pretty good. Little kids, when they start walking, they run. But they are like more serious runners at 18 months, but they're clumsy. They can throw a ball overhand. If they did it earlier, it usually would fall backwards out of their hand. They can jump up and down in place, and that's thrilling to them. And they can pull and push toys. 2 years old can usually walk up and down the stairs while, of course, holding on. And 2.5 can jump across the floor like a bunny rabbit. And they can take stairs. They can stand on one foot, for a few seconds. And they can do tippy toes. Okay, toys and activities for toddlers. A lot of them are some of the skills they can do. One of the things to remember is a toddler from 1 to 3 years old does parallel play. They like to play next to another child. They might even go and get something and sit down right next to another child, but they will not play with that child. You can't get them to roll a ball to another child for very long because they don't like it. They remember it's all about me. I want to do this myself. So even if there's other children in the room, generally speaking, they're going to still play by themselves. These are important things to know about toddlers. And I find these things kind of funny myself. They are known for temper tantrums. And remember, they're very negative. Temper tantrums usually will last until they're about 30 months old, about 2.5. I'm going to be honest, sometimes they last longer. And it's okay. They react to being restricted, like from their independence. And they usually don't have enough of the language skills to express their frustrations. So instead, they think they're telling you, no, I don't want to do this, and or I don't want to do that, and please don't make me do this. And you're not letting me be autonomous. And instead, they're having temper tantrums. So some kids will even hold their breath to the point of passing out. And the one thing that's really important is to make sure they're safe. If they're going to throw themselves on the floor, they're going to bang their head, make sure they're safe, they're in a safe spot. And as much as possible, ignore these behaviors. Totally, totally ignore it. Once in a great while, children will get into these temper tantrums and they can't find a way out. They're exhausted. They're screaming and crying, and you're letting them, and they can't control themselves. They just don't know how. Remember, they're just learning to be independent. So at that point, it's okay if it's been a while to go over, give them love, not even talk about it and say, oh, come on, you've been crying a long time. Let's go read a book. Come on. And generally, they'll go with you and forget about it. So if it's a child you're taking care of in the hospital and, they're having a temper tantrum over every single little thing, you let it go. You're not going to stop them by crying, by trying to stop them. But when it goes on for, a little bit too long, you just try to distract them and get their mind off of their problems. Generally, I know I said it lasts till 30 months. Generally, temper tantrums will be outgrown by 4 years old. So, unfortunately, yeah, that's a long, long time, right? Toilet training usually begins around 2. I wouldn't do it any sooner. I'm going to tell you because children do not have the muscle control until around 2 years old. So when parents tell us that their child is potty trained and they're only, 9 months old, it's like, well, you can put them on the potty and they might go for you, but they have no clue what they're doing. So around 2 years old, toilet training is usually okay to do. The myelination is pretty much there, so the muscle control should be there. They're usually not toilet trained in the nighttime, but only during the day at first. And it has to be on the child's, how do I want to say it? The child has control over this. They want to be independent, so it has to be their idea. And I always suggest people get a little potty chair or whatever they're going to use, have it available, take the child to it once, show them how to do it, and then have them asked to do it. And then generally it takes a day or 2. It doesn't take long for them to potty train. They need to be able to pull their pants up and down themselves because remember, they want to be independent. Bedtime potty training or bedtime control for many children is not established till they're 5 years old. Some are just totally potty trained, 2, 2.5, 3, they're done. But we consider them potty trained if they have control all day long, but they need to wear a diaper or pull up at night until they're 5 years old. After 5 years old, something's going on that we have to work on it. But until 5, it's totally, totally normal. Discipline for these kids. These kids need limit setting. They need boundaries. The discipline needs to be consistent. The child needs to know defined boundaries, and this will help them establish appropriate social behavior. Remember the word punishment. I just want to explain this to you. Latin, if you look at Latin words, the word punishment means inflicting pain. The word discipline means teaching. So we want to teach the child what's right and what's wrong and what's appropriate. By spanking and doing things that are harmful, painful to the child, they're not going to learn. They might learn, but it's certainly not what we want to do to our children. So around 18 months, it's pretty cool. They really become a handful at 18 months. They're really independent and they're kind of naughty. They start to do the terrible twos, some of them. And so it's really good to use timeout. 18 months is a good time for timeout. It can be putting a high chair in a corner somewhere. It can be sitting on the stairs and holding them, a special place where you hold them still for a few minutes. You don't talk to them. It could be putting them in their crib, although, in some situations, some children, that might cause bedtime problems eventually. Usually, a timeout should be 1 minute per each year. So if the child's 2, it's only 2 minutes. And generally, the 2 minutes start after they stop crying. Because if they're still carrying on, they're really not ready to get, out of the timeout. So remember that discipline has to be consistent with well-defined boundaries. And the reason we do it is to establish and develop appropriate social behavior. Okay. Vocabulary increases in toddlerhood. And let me find the exact amount of words. I don't know if you're going to remember this, but vocabulary is a little important to know. I'm looking for my little notes on that. Okay. Usually at 12 months old, children usually use one word sentences. Yes, no, hi, bye, hot. Somewhere between 1 and 2, they'll start 2 to 3 word sentences. Yes, please. I want to go. That's 4. It's usually want to go. 2 to 3 words. And then usually by 2 years old, they can say about 300 words. A child should be beginning to talk between 15 and 18 months. We should hear some words from them. If not, they need to be evaluated by a speech pathologist. The first thing that we do is we check their hearing to make sure they're hearing okay, and then we have them evaluated by speech so that they can, catch up developmentally. And then last but not least, separation anxiety usually begins, and the child really wants to not be separated from their parents usually. And so they'll cry and carry on if, in fact, they are separated from their parents. Separation anxiety is very, very normal. All children usually go through it. It usually will last until they're 3 to 4 years old. So the best thing to do is the same thing that we do when the parents are going to leave them in the hospital is, give something of their parents to them and then use distraction. So let's first talk about death. This age group has little to no concept of death. they really have egocentric thinking, and that kind of prevents them from even considering what death is. You know, they just can't fathom what that is. Um, they may mirror how the parents are acting or their emotions, and they may regress if things are out of routine for them, and their parents are sad. If they've just gotten potty trained, they may no longer be potty trained for a while. They may start acting like a baby. Actually, the reaction we see in toddlers to death in general is mainly because the routine has changed, not because of death. Things aren't going along as they normally do. So, unfortunately, or maybe fortunately, they don't get it. Probably one of the most common cause of death for toddlers is actually what we call unintentional injuries, which means an injury that we don't expect to happen or an accident. And what was listed as the most common for this age group is drowning. Unfortunately, people leave children alone with water and they don't know what to do with it, or they're not steady enough with it and they drown. With pain, how do we know that our little patient is in pain? Well, they actually will scream very loudly or cry. They can say ouchies, and a lot of times they will. The younger child will be more thrashing about. They will start pushing you away if you try to maybe pick them up to take care of the pain, or if you're trying to console them. They'll be very non-cooperative at this age. They may cling to a comfort person if that's a parent or a nurse that they've become very close to. And if they think you're going to do something painful and they remember it from the last time, some of these behaviors may start before it even, happens. So for instance, they know that when they see a certain person come in, they're going to draw their blood. They may start to scream and thrash about and push the person away. And of course, they won't be very cooperative. This usually takes a couple people to help the child through this situation. So when you're taking care of children, it's important to be able to judge if they're in pain. One of the things to do right off the bat is ask the families at this age group, do they do this behavior often and when do they do it? And a lot of times the parents will be able to tell you, well, usually only when they're in pain they do this, or I've never seen this before. Then we need to take a look at the pain scale. The child, number one, is going to overreact because they don't understand pain and they're afraid. And so the pain scale is very helpful. This is the FLAC again, the FLAAC pain scale. It stands for face, legs, activities, cry, and consolability. So we'll take a look at that and see what's going on with the child. The higher the number, the more pain the child is in. Sometimes you'll get orders for pain medication, and it'll say with the flex scale of 3, go ahead and give this. Sometimes there'll be 2 kinds of pain medication. Maybe it's a little Tylenol. Tylenol is used a lot. And then if it's like something post-op or, something serious, a new fracture or whatever, they might have a little morphine also ordered. So if the flex scale is 5 and above, give this. So that'll be helpful for you. And you'll know too, you probably don't even need to do that. The higher the number, the bigger the guns. So hospitalization in children is pretty traumatic. One of the problems with toddlers is they don't have the words to describe their illness. They don't know why they're there, and they can't really explain it to you. They are poorly developed sense of body image and boundaries. They still are figuring out, for instance, if they have a headache, they don't understand that the headaches. They just know they don't feel good and they will cry. They can't tell you which body part is hurting. They do not understand the need for therapeutic communicate or procedures. If these procedures are going to hurt, why are you doing them to me and I'm going to cry? I don't want to do them. I just want the pain to go away. They cannot follow directions yet. They're too young. So that's very difficult to take care of them. They're too young to follow directions. So drink this liquid. No, I don't want to. And it's spilled all over the bed. You can't expect them to. You have to just kind of take over. They experience separation anxiety from one of their adults. It's very important to offer to allow parents to stay with them if at all possible. And every hospital will allow a parent to stay. Sometimes they can't. Sometimes they have 5 kids at home. And sometimes the only income is the person that's there right now that has to leave. So that's going to be very difficult for them. They come in with this pain that they don't understand. They can't describe it. They can't explain it. You're telling them to do things they can't do. And now the only person that they rely on is leaving. This may cause regression. If they're potty trained, they may not be potty trained in the hospital. If they're normally a wonderful little child that talks and plays, they are now having temper tantrums. They won't cooperate. They won't feed themselves. If you're going to get them to eat, you might have to feed them. This is hospitalizations for toddlers. Toddlers are tough. We need to encourage parents, if they're staying, to provide the routine care. Some parents don't want to step on your toes, so they won't offer to clean the child up or freshen the child up. But really, who would the child rather have touch them, you or them? So letting them be part of the care is really important, and anything the parents can do is fine. So you know how you were always taught when you sign out a medication that you need to give it to them? If you sign it out and you take it in there and you give it to the mom to give to the kid is probably going to take it. You can ask the parents, will they take it from me? The parents will know as the toddlers, but a lot of toddlers will only take it from somebody familiar. So as long as you're there watching it go in the kid, you administered it, even though mom, in all reality, is the one that administered it. But you measured the dosage, you took it in there, and you saw it given. Okay. It's important to offer choices. Now, you don't want to say something like, do you want to take your medicine now? Because that's not an option. But you can say to them, do you want to take your medicine on a spoon? Or do you want me to put it in a syringe? And you can show them both of them. Which way are you going to take your medicine? Which way is better for you? You can give them that choice. Do you want mom to give it or do you want me to give it? Those are the kind of choices you can offer them, because remember, they want to be autonomous, so that'll help their autonomy, and they'll cooperate if they think they're being independent and given a choice. It's important that the same people take care of the child as much as possible. Sometimes it's not always possible, but most hospitals do try to do this because the children will get familiar with a nurse and then begin to cooperate maybe where they weren't in the beginning. It's also good for the family too. The family wants to talk to the same nurse. Like you bond with them. They think you understand them, you understand the child. The more you're with the child, the more you'll understand them. You always want to provide atraumatic care. Here's the term again, atraumatic. That's care that isn't traumatizing or painful to the child. You want to stop as much of the pain as possible. So you want to be gentle, you want to be kind, you want to rub the owie, put some pressure on it, rub it. You want to provide some anesthetic to an area where you're going to give a shot or start an IV, atraumatic care. You want to find out the home routine so that you can continue the home routine as much as possible so that the child isn't totally freaked out because everything's so different and he's not going to cooperate. But if he starts recognizing some things, oh, this is the time I eat. Oh, I do use a sippy cup. It'll go better. And then you want to use play therapy. Cloth books, puzzle, get their minds off their trouble. A baby doll, a teddy bear, all of this is a reasonable thing for a child. The three and onwards, you can like say, this is the procedure that we're going to do to you, but let me show you on this teddy bear. But under 3, you can't. They really still don't get it. You can try it, but really by just giving them time to play, it will certainly help that child with their hospitalization. Um, these are the safety issues, and these are the things you need to teach parents before they go home. Usually, most nurses go over just general safety things, aspiration. You want to be careful that if these are oral kids still, they're putting things in their mouth. You want to make sure that little tiny things are kept up high. Bodily harm, which is the unintentional injuries, burns. These kids will reach up to a stove and pull a pot and pan over, maybe with burning water or oil in it. They'll touch, do you want to check the bath water? It might be hot. Radiators and places that still have heaters and radiators. These are all dangers to children. Of course, drowning, falls. If they're in a bed, we want to keep the side rails up or, lower the bed to the floor. Motor vehicle injuries. These children need to be in their car seats to keep them safe. Poisonings. You want to keep all medications, all alcohol. Of course, in the hospital, we won't have alcohol, but you can teach the parents all cleaning supplies out of the reach of the child. And then suffocation. Toddler issues. They might grab some sharp objects and not want to give it back to you. You've got to take care of that. That's a pretty normal thing to do. Never leave a child unattended with an animal under any circumstance. Even when the therapy dogs come in, somebody needs to be in the room with that child and the dog. Once again, the pot handles. Keep outlets covered. These children can get sunburned. They always need sunscreen on prior to going out in the sun. Never leave it unattended in or near water. And a big problem that I've seen a lot in inner cities is kids falling through screen windows, right through the screen. They go running right through it, or open windows. So that's the main problems with this age group, besides the normal things, the temper tantrums and so forth. But these are issues that are brought to the emergency room often. And then guiding the parents. Birth to age 2, they need rear-facing car seat. No two ways about it. 2 to 4, and no more than 40 pounds. They can be facing forward, of course, still in the back seat, and a child safety seat. It depends on how much they weigh, how big they are. They might still fit in that baby seat, but they can be facing forwards instead of backwards, and some can sit in the booster seats. Children should not eat or drink lying down or playing. Number 1, they could choke, but number 2, they may fall asleep, or it may just allow the food or drink to sit on their teeth and cause cavities. Potential choking hazards are here. And this isn't all. These are foods. But other things that I've seen toddlers choke on are Legos, light brights, the little things that you put in the light bright. The sequence, some of the like hats, and we don't see like a lot of winter hats here in Florida, but they're beaded or have sequins, and the child will put it in their mouth and choke on it. Remember, popcorn, they have to be older for popcorn. Peanut butter has to be thin. Raw carrots, they will shove too much in their mouth when they're first learning to eat on their own. Grapes, they're round, they're the same size as the trachea. They need to be cut. Nuts. Nuts are given for several reasons. Although, after 1 year old, they could have some nuts, but nuts can choke them. I'm not as much worried about allergies as I am about them choking. Popcorn is a big thing that children choke on. And then this is kind of cute. This is a little like kind of poem thing. And if you take care of toddlers long enough, you're like, oh yeah, I've seen this 1,000 times. So I put it here for you so you can kind of get the feel of where they're at. They're not the easiest age groups to take care of, but if you smile and kind of just, I don't know, I find them funny, as they're learning things or trying things. If you kind of look at it that way, it's easier to take care of them. And that's it for this one. So fill out your little form and good luck.